Together we achieve victory over heart failure.
Hello everyone, this is Dr. Kunal Parwani and I am Assistant Professor of Cardiology at UN Mehta Institute of Cardiology and Research Center, Ahmedabad. I am a full-time consultant cardiologist over here, do all kind of interventions including angiography, angioplasties, devices, pacemakers. And today a topic of discussion is monitoring your heart failure conditions. Because it is very difficult to notice heart failure right away. As our heart faces increased strain, it compensates by working harder. So, yet as heart failure progresses, its ability to pump blood diminishes gradually. Over time, the subtle changes may go unnoticed, and that is why it is important to recognize heart failure symptoms. So, what are the heart failure symptoms? Swelling in the feet, ankles, or abdomen, along with sudden weight gain, are common signs of heart failure. So, monitoring your weight can also help manage the swelling. Shortness of breath during daily activities and interruptions in breathing due to persistent coughing or wheezing, it warrants some medical attention. Difficulty in sleeping may indicate heart issues. Fatigue, confusion, or fainting may signal inadequate blood flow to the brain. And other symptoms like rapid heart rate, nausea, or lack of appetite could also indicate heart problems. If you notice any of these signs, you have to seek a prompt medical care. Let us discuss about the key heart numbers. So the first is blood pressure. High blood pressure is harmful because it makes the heart work harder and less efficient. Fortunately, high blood pressure can be easily detected. The normal blood pressure should be less than 120 by 80 millimeter of mercury. And when do we call that the blood pressure is elevated? Is that when it exceeds 120 systolic and more than 80 diastolic. So that is when we call the blood pressure is elevated. The next crucial number to understand is your cholesterol level. Cholesterol, when combined with other substances, can form hard deposits in your coronary arteries, reducing their flexibilities. So normal or healthy level of cholesterol differ depending on the age and sex. For people 19 or younger, LDL cholesterol should be less than 110 milligrams and HDL should be more than 45 milligrams. For men who are aged 20 years or older, the LDL cholesterol should be less than 100 milligram and HDL should be more than 40 milligram. And for women who are 20 or older, LDL cholesterol should be less than 100 milligram and HDL should be more than 50 milligrams. So on an average, the LDL cholesterol should be less than 100 and HDL should be more than 40. Now let's talk about heart rate or pulse. Your heart rate is the number of times your heart beats per minute. Your resting heart rate is the lowest rate your heart beats when you are not exercising. Typically between 60 to 100 beats per minute when you are calm, relaxed. For moderate exercise, aim for 50% to 85% of your maximum heart rate. Many wearable activity trackers can monitor your heart rate during exercise and throughout the day, helping you keep updated on your cardiovascular health. So that is all I wanted to talk about the heart today. And this concludes my today's discussion, that is monitoring heart failure conditions. Remaining proactive is the key to safeguarding your heart from heart failure. That's all for today. Thank you.